Walking or atypical pneumonia is the name for a mild infection of the lungs. It is called atypical because this disease mostly resembles a bad cold and doesn't usually require hospitalization, and many can still act normally in their daily lives because of its milder symptoms. It is most commonly caused by the bacterium Mycoplasma pneumonia, which can often be mistaken for a virus when examined because they do not have a typical bacterial cell shape and have a natural resistance to many medications that would typically work for bacterial infection. Part of this immunity is because they lack a cell wall, which makes them inherently resistant to beta-lactam antibiotics such as penicillin. Other parts of their immunity are caused by genetic mutations that occur within the bacteria. Walking pneumonia is spread when an infected person sneezes and/or coughs, and the infected particles are spread throughout the air and breathed in by another individual. These symptoms can take a while, from 1 to 4 weeks, to show in the infected individual. And these symptoms can range from sore throat, fatigue, chest pain, mild fever, a stubborn, dry or phlegmy cough, sneezing, and/or headaches. And during the later stages of this illness, these symptoms have been known to increase in severity for a short period of time before the illness goes away. Typically, walking pneumonia is treated with macrolide, tetracycline, or fluoroquinolone classes of antibiotics taking the age of the patient and local antibiotic resistance patterns into consideration. Since fluoroquinolones and tetracyclines can't be used on young children in ordinary situations, most clinicians use macrolide antibiotics because of their low minimum inhibitory concentration against the bacteria, their low toxicity, and they can be used in young children. The newer macrolides are the preferred treatment methods nowadays, with a 7 to 14-day course of oral clarithromycin or a 5-day course of oral azithromycin for the treatment of walking pneumonia. However, macrolide resistance has been increasing for the past 15 years at an alarming rate. This resistance has resulted in prolonged symptoms and prolonged possible hospital stays, as well as the need for alternative antibiotics, which may include tetracyclines such as doxycycline or minocycline, or fluoroquinolones such as levofloxacin for 7 to 14 days, even though fluoroquinolones shouldn't be used on children at all and tetracyclines shouldn't be used on children less than 8 years old. So far, no acquired resistance to tetracyclines and fluoroquinolones has been noticed in Mycoplasma pneumonia lab cultures. However, there have been cases of mutated versions of the bacteria having a reduction in the vulnerability to the drugs. Aside from antibiotic treatments, other recommendations to avoid contracting this disease is to wash your hands, eat a well-balanced diet, and exercise regularly in order to keep your body in good condition and your immune system up. And avoid smoking, since this injures lung tissue and can cause infection. Thank you.